A sudden decline in the bedroom is rarely an isolated issue. Statistically, a drop in erectile function serves as a 7-year early warning system. For 14% of men, this localized change is the first measurable sign of a future heart attack. Yet most men treat this decline as a private performance problem. They hide the issue, hoping it will resolve on its own, missing the signal that their cardiovascular system is already under strain. That embarrassment often leads to dangerous internet myths. Instead of seeking a physician, many attempt unproven do-it-yourself enhancement tricks and makeshift devices, causing physical damage to the very tissues they are trying to fix. Your reproductive health is an early diagnostic tool. When the smallest, most sensitive vessels in the body begin to fail, it provides a window into the health of your entire arterial network. To maintain long-term health, we have to understand the mechanics of this cellular ecosystem. There are 3 specific biological pillars that keep this system functioning, and neglecting any one of them has long-term consequences. The first pillar is vascular dynamics. Your body runs a subconscious maintenance cycle every night. While you sleep, a rhythmic influx of oxygen-rich blood moves into the reproductive tissues, maintaining tissue elasticity. By preventing rigid scar fibers, this cycle ensures structures remain flexible over time. But these microvessels are sensitive. Chronic stress, a poor diet, and smoking damage the arterial lining, cutting off the oxygen supply and halting this internal maintenance process. This graph tracks the correlation between the failure of these microvessels and major cardiac events. The data shows a clear pattern. The onset of erectile dysfunction often precedes heart attacks and bladder cancer by several years because the underlying vascular damage is the same. Failing to protect these pathways allows underlying cardiovascular disease to advance, turning a localized issue into a major risk to your lifespan. The second pillar is structural tissue integrity. The core of this anatomy is the tunica albuginea, a fibrous, pressurized containment sheath. Internet hacks or makeshift constriction devices subject this sheath to unnatural force. This mechanical stress creates permanent stress fractures, leading to chronic dysfunction. Under sudden impact without control or lubrication, this sheath can suffer a full penile fracture. This is a physical tear in the tunica albuginea that requires immediate emergency surgical repair. Integrity also involves the external tissue. Using aggressive, heavily scented soaps can cause microlacerations, while poor hygiene creates an environment for infections like balanitis. Ignoring hygiene or warning signs like painless ulcers and blood can mask the development of aggressive penile cancers, which are treatable if caught early. Subjecting these tissues to mechanical trauma or daily neglect transforms manageable health concerns into permanent disfigurement or the need for emergency surgery. The third pillar is neurological and endocrine balance. The testicles require an environment that is slightly cooler than the rest of the body to produce both sperm and hormones. Constant exposure to high heat, like resting a hot laptop on your lap or frequent steam room use, degrades sperm quality and slows testosterone production. While temperature affects hormones, behavior affects the nervous system. A common behavioral risk is death grip syndrome, caused by aggressive, repetitive physical pressure. This chart compares tactile sensitivity levels. Habitual high-pressure stimulation desensitizes nerve endings and artificially raises the threshold for arousal to a level that natural intimacy cannot match. By disrupting your thermal environment and neurological baselines, you rewire your body's response system, making it harder to maintain natural biological function. Neglecting these 3 pillars has consequences that go far beyond the bedroom. It increases the risk of emergency surgeries for structural tears, undetected cancers, and the long-term decline of your cardiovascular health. To protect your future, you must abandon unproven DIY hacks, prioritize gentle hygiene, and focus on supporting your vascular health through consistent exercise and a nutrient-dense diet. Most importantly, do not let embarrassment stop you from seeing a doctor. If you discover an ulcer, experience pain, or notice structural changes, immediate medical consultation is necessary. By respecting these biological requirements and maintaining your vascular and structural health, you are protecting your vitality, your hormone levels, and your long-term cardiovascular resilience. Take control of your biology today.